because you don't see them a lot. But we're going to manually prime the tubing. We're not going to use the pump. And so when we do this, we take our medication. These plungers are reusable, so they just go in there and they click in place. Ron said they had a problem the other day. There's two little sides in there.
Right.
So maybe one of those was cracked. If you have any trouble locking it in, you're better off just wasting the syringe and getting a new one. Okay, so we put this in here. We manually prime it. But remember, this pigtail will never get primed because there's that valve right there. So what I recommend to people, anybody on PCA must have an IV. This PCA tubing comes a main line, and your IV would go into here before you hook it up to the patient, and then just prime it. Okay? All right, so to put it in here, you see these little gray things. It looks like there's not enough room, but there is. This just slips right in there. Pretend this is the medication that's marked on the syringe. You always want this facing forward so that the next shift can see it. Don't assume, if you don't see the medicine, that it is the correct one because it's your license that you're working on during your shift, okay? So we put it in, we've primed it, we put this in here to hold it in place securely. One thing also that's so important, always clamp the tubing when you're putting it in and when you're changing the syringe. Because watch when I do this. If I'm in a hurry and I do this, I push down and the medicine's going to go through and you're going to bolus the patient. And depending on the patient, maybe a bolus would be way too much for them. So, all right, an unintended bolus. All right, so we've locked it in place, and this is real simple. You just turn it sideways till as far as it goes and let go. So, all right, we've got this securely in place. This goes right here. This little thing here, one of the units I just in-serviced didn't realize this. This machine locks to the brain. Remember the old pump, it locked to a pole. It was big and it locked to a pole. Mm-hmm. This one locks to this. It must go on the right side of the pump while you're looking at the pump. So it's really the left side, but it's when you're looking at it, it's got to go on the right side. It would fit on this side, but if you put it on this side, there's no locking mechanism, so it won't. You can't program it. It won't operate. All right. Now, when you want to get it off, you just press this thing down, and it comes right off. Okay. But see, what makes it safe is when this is locked, people can't access that button to release it. So, all right. So we're going to lock the pump. Sometimes it doesn't catch, a lot of times, but I know it's locked, so you just push it and it locks, okay? You'll see a little silver thing in there. Okay, so we're going to turn the pump on, so we've got it primed. We can now unclamp this. I can't stress how important it is to have it clamped when you're putting it in and when you're changing the syringe. So we will program this. When it first comes on, it asks, is it a new patient? And this is something you're very familiar with. So we're going to say, yes, it is. Is it critical care? Yes. Okay, now we're going to, because we want to program this module, we're going to hit channel select. It says to set the key to the program position, which is just sideways. And it has position right there on there. Okay, so time of day, I've always seen it correct, but if it wasn't correct, you just hit change time and literally just put the numbers in. It's the correct time, so I'm going to hit confirm. It needs to know what the syringe is, what kind. Most of them are going to be monojack, but we have gone through shortages, so you may get a different one. The machine is that specific that depending on the type of syringe it is, it recalculates how it delivers. So even though it's the only selection monojack, which it does say it on that syringe, we're going to check that, we're going to pick that, and then we're going to hit confirm. Now let's pretend that we're hooking up a more dilaudid PCA. We do use a lot of those in the hospital. So I'm going to pick hydromorphone or dilaudid. You have two options, standard or high concentration. The standard is what we've always had, 0.2 milligrams per milliliter. The high concentration is something new for this hospital. It is a 1 milligram per 1 milliliter. So it's 5 times as strong. Instead of getting 6 milligrams in the vial, we'll get 30 milligrams in the vial. It is a 60 milligram vial or 60 milliliter, but because of drug shortages, we don't want to put 60 milligrams of Dilaudid in there because many patients won't need 60 milligrams. So they'll make it with 30 milligrams, which is still a big help. So the two safety features about using the high concentration, which for this department, I don't see any reason to use it. You don't have them that long. I would use the standard always. But just in case someone comes to you with it or whatever, the high concentration syringes will always be in the 60 milliliters, like I said. The other ones, the standard, are always in a 35 milliliter. Second thing is you'll never find the high concentration in the Omnicell. Never. Always has to be picked up from pharmacy, and they won't give extra. They'll give you one at a time. Now, for a unit like oncology, last week they had a patient that was going through syringes in 2 to 3 hours. It was worth the time to go down and get a high concentration. They got 15 hours out of that syringe, so, okay? All right, but for your, for this department, you're going to hit the standard. Now, once you hit the standard, you can't go wrong in this program the concentration because it tells you it's 0.2 milligrams per milliliter. We say yes, and that will be listed right here on the syringe. Okay, it asks you to have a second nurse check the concentration, but we don't do that. We do it at the end when we're all done setting it up. So we're going to say confirm. This screen is really just to show you once again the concentration, which I can't stress enough how important it is we set that correctly or the entire program would be wrong, and it would be a real safety hazard for the patient. So yes, that's the concentration. We're going to hit next. Infusion modes, let's say we're going to do a PCA in continuous. Our other option is PCA only. There's two other options on here that you'll never use, so we're going to go with PCA in continuous. Now, it just has the open field. We just need to fill it in. So for this patient, a routine dose for dilaudid PCA is either 0.3 or 0.4. So please, if you see a 0.1 or a 0.2 and it's not a 90-year-old woman, please get that changed. There is a 5-to-1 ratio between dilaudid and morphine. So if you have someone with a 0.1 milligram PCA dose, that's like giving someone a 0.5 milligram of morphine, which most of the time, if that patient was going to be on a morphine PCA, they'd probably do 2. So again, 5-to-1. So 0.1 is equal to 0.5 milligram, 0.2 is equal to 1 milligram, 0.3, 1.5, and 0.4, 2 milligrams. So, all right, so we're going to put in 0.4. This is a healthy 40-year-old patient. The lockout interval, a good lockout interval to use is 8 minutes. Continuous infusion, because we did pick that. For dilaudid, you might go as little as 0.1. That would be equivalent to 0.5 milligram of morphine because we just sometimes like a low basal rate, just something in case they fall asleep. Max dose, I do always recommend a max dose with a continuous. And to be honest, even without a continuous, I think it's a good idea. There are times when someone other than the patient's pushing the button, and again, at least a max dose limits that to some extent. Okay, so yes, I want a max dose. For dilaudid, I usually pick 8. 6 should be the lowest that you pick. But 8's a good one, 8 milligrams in a 4-hour period. If somebody, you're setting up the PCA for the first time, they're probably in pain. Now, unless you've been medicating them with IV push and that their pain is controlled when you're setting this up, otherwise, please give a loading dose. So yes, we do want to give one. A loading dose for dilaudid could be anywhere from 0.4 to 1 milligram. So again, if their pain level is greater than a 5, give them a loading dose, because otherwise it'll take them a long time to keep pushing the button to get themselves comfortable. So we're going to put in 0.3 because we don't want to wait while it goes in. And then we're going to confirm. We're looking at this, and I've got hydromorphone, which is up. It mentions it on top. PCA of 0.4 every 8 minutes, continuous of 0.1, 8 milligram for our lockout. I'm going to give a loading dose of 0.3 because their pain level is at 6 right now. I'm going to confirm that, and I'm going to close and lock the door. And then you hit start. You will notice that you have to hit start a lot. Not a big deal. And then it's infusing. Now, as you can see, it's saying it's delivering it. Another way, this thing is green. Now, it's solid green because we gave that loading dose. And what that means to you is that when the loading dose is done, it's solid green. That patient could give themselves another dose, which is fine. Sometimes they're paying so much. We give them a loading dose, and if you don't want them to get another dose, put it to the side for a minute or two while you're in there, and then tell them, wait a few minutes. Now, when a patient pushes a button and gives himself a dose, this will be flashing, and that's how they'll know that they're getting it. It'll be a light. It'll be lit up. It'll be flashing. When the patient's in the lockout period, it'll have no light at all, which is a really nice, easy way for the patient. If it's lit, you can get it. If it's not, you can't. Okay. Now we're going to do. So that's how to set it up. Now we're going to do a clearing the history. This needs to be done every 8 hours. It should be done at 6, 2, and 10, okay? And then get documented on the iView. All right, what's so nice about this is you don't need the key at all. You don't need to stop it. So this is nice if a couple of you have to clear it and you don't have to go get the key. All right, so we are going to hit, we don't even have to stop it. We're going to hit channel select because, of course, we want to work with this module. We're going to hit options, and we're going to hit patient history. Now remember, if you forget those steps, it is right here on the cheat sheets. All right, patient history, what they want you to do, and this is important, they want you to zoom to 24. It automatically defaults to 8. So we zoom to 24, we look there, and it says 0.301. That's your shift total. You clear it right there. It's going to ask you sure you want to clear it? You say yes, and it's gone. Okay, so it's as simple as that. You didn't need the key. You didn't need to stop it. You will have to hit start because we've done something to it. Now what's nice for me and for you too is sometimes the doctors will come in and say, okay, let's DC the PCA. Probably won't happen here, although you do sometimes have people 2 days. So you can come in and, or they may call me in and say, hey, we want to get this patient off of PCA. And I'll say, well, how much have they been using? All I need to do is hit this 24-hour dose. And even though you've cleared the shift 3 times or more, it will tell me a running 24 hours. And that's all I need to know, and that's all you really need to know. And say, you know what, doctor, this patient has used 6 milligrams of Dilaudid in the last 24 hours. I don't think they're ready to go to Norco. You know, things like that. But it's very important to me. If you look at here and you say, my gosh, they've only used 0.3 milligrams since we started, then fine, take them off and, you know, put them on a Norco. All right, we're gonna hit start, and it's going again. All right, any questions about that? Okay. One of the other things, say that you've got that continuous going, and the patient's getting a little sleepy, or the patient's saying, wow, you know, I got some Toradol, and, you know, I'm doing pretty good now for the last couple hours. I don't think I need that continuous anymore, or the doctor wants it off. It's so simple. The other machine, for those that remember, you had to turn the pump off and start over, but not with this one. So, all right, so what we're going to do is we're going to pause it. All right, we're going to hit channel select. Right here it says program, so we're going to hit that because we want to make a change to the program. We're going to turn this to program. Right here it says change mode. Now, we don't want the continuous anymore, so what do we want now? We want just PCA only. So what do I want to change it to? PCA only. And that's it. The continuous is now off. It's gone, okay? And so all we do is confirm. That's our thing. And we lock the door, okay? Now, just as important, maybe you set it at, maybe the resident gave you an order for a Dilaudid 0.1, and you called them and said, this isn't enough, I need it to be higher. So it gives you an order for the 0.4. Okay, so, I didn't hit start. So, just,
I got that last week.
Did you? Okay.
From Dr. Gear. I was like, this doesn't make sense.
Yes, I think I remember that. All right, so this is where you probably will use it. So, okay, we're going to hit pause. We're going to hit channel select. We're going to hit program. It's going to say turn the key. Now, this is just, it lets you change any part of that program you want. So we're going to pick the PCA dose. And in this case, it is 0.4, but the patient's getting a little too sleepy, so we're going to put it to 0.2. And that's what we want, 0.288. We're going to confirm it. We're going to lock the door, and we're going to hit start. And it's as easy as that, changing. So any part of that program you want to change. If you want to change the mode, it's just one extra step. Down at the bottom, you hit mode. Okay, now this is something that also you're going to have to probably change the vial. At some point that they're in here, there's a chance you may have to change it. So we're going to hit pause. Okay, we're going to unlock it. And I'm not sure why this always beeps so much, but when I figure it out, I'll let everybody know. All right, so we're going to take this out. We are going to clamp this, okay, while we're doing that. Okay, and then we are going to take this out, and we're going to pretend now that we're changing the syringe. So, again, this is reusable, so don't throw that out. Get another syringe. It's already primed, so just plug it in. Again, we're going to have it facing so you can see the medicine. Put this thing here to secure it. All right, that goes in there. This goes down, and we're going to lock it. See, a lot of times it doesn't catch, so you just have to push it. Okay, so now we're going to do channel select, set the key to program. It's asking you again the syringe, because remember we put a new syringe in. It may not be a Monoject this time, but it is. So we're going to hit Monoject and we're going to hit confirm. Now, a lot of people, I don't know about a lot, but some people would say, okay, Dilaudid hydromorphone was going, and they'll hit the hydromorphone. But you don't want to do that. There's a little button here that says restore. You just want to hit restore. And when you look at restore, it will ask you about the concentration, because this is a new syringe, might be a different concentration. In this case, it's not. So we're going to say next, because it is the 0.2 per milliliter, and there's your program right there. So it's 0.2 every 8. We hit confirm, we lock, and we're ready to go. So let me just show you the other way, because you'll still get to the same thing, but it's a lot more steps. So Okay, and a lot of people were doing it, so we're going to pause it. We're going to unlock it, take the syringe out. Okay, we're going to make sure it's clamped while we're doing this. We're going to put this here, and put that there. Okay, sometimes you'll see this on here, syringe installation, but I just hit confirm. Okay, again, asking us for the what kind of syringe, so we're going to hit that, we're going to confirm. Now, say I did pick hydromorphone, because that's what was going. Okay, hit hydromorphone. Wants to, again, to know about the concentration. So, and this is the way you'd have to do it if you actually have a new concentration, okay? So we're going to pick the standard, 2 milligrams, 0.2 per milliliter, yes. Wants another nurse to check. It's going to show you what the concentration is again. We're going to hit next. You're going to have to pick, well, it was a PCA, what was the last one? I think we were only on PCA, weren't we, because we took it off. So PCA only, set the key to program, and there's our program. Well, that was a lot of steps to do if it's the exact same syringe, okay? So we're going to hit confirm, that's what it is. I'm going to lock the door, and I'm going to hit start. All right, so that shows how to change the syringe. We showed you one more thing. Say you've got it going, but the patient's saying, you know, I'm really hurting, and you know, I'm pushing it so much, and we want to give a bolus dose. You know, you can call a doctor and say, can I give her a bolus? I didn't think I needed a loading dose, but now I need a bolus. So, all right. So what we do is we hit pause, and we hit channel select, and right there is bolus dose. So I'm going to hit bolus dose, set the key to program. Might give a bolus dose of 0.3 and confirm. And then just lock the door, hit start, and that loading dose will be going. And then it will just resume because there's no continuous. It'll just resume. So, all right. So, any questions or anything that you have come upon when you've been using the pump? No? Okay, seems pretty easy, doesn't it? I think the nice thing is, first that Ron videotaped it, but the second nice thing is having this right here. During the day hours, you can by all means give me a call. I'm here usually between the hours of 9 to 5. Usually a little earlier, a little later, but 9 to 5 for sure. All right? So, again, I think it's a nice thing, and I think that's it. So what I'm going to do...